Hello, this is Dr. Kayla White, and today I will be discussing post-traumatic stress disorder, or PTSD. A description of PTSD is a psychiatric disorder that may occur in people who have experienced or witnessed a traumatic event, such as a natural disaster, a serious accident, terrorist act, war, rape, or even patients that have been threatened with death, sexual violence, or serious injury. Women are twice as likely as men to have PTSD. Most individuals who experience trauma react to some degree when experiencing those reminders of the trauma. But patients with PTSD, however, experience marked cognitive, affective, and behavioral responses to stimuli, and that can lead to flashbacks, severe anxiety, or fleeing or combative behavior. These individuals compensate for such intense arousal by attempting to avoid experiences that may begin to elicit symptoms, and that can result in emotional numbing, diminished interest in everyday activities, and then in the extreme may even result in detachment from others. So looking at diagnostic methods, a comprehensive psychiatric assessment, and then to be diagnosed with PTSD, an adult must have all of the following for at least 1 month. So they must have at least one re-experiencing symptom, and this could be flashbacks, bad dreams, frightening thoughts. They must have at least one avoidance symptom, and those are examples: staying away from places, events, or objects that are reminding them of the traumatic experience, and also avoiding thoughts or feelings related to that traumatic event. They must have at least 2 arousal and reactivity symptoms, and those are things like being easily startled or feeling tense or on edge, having difficulty sleeping, having those angry outbursts. Those are all examples of those. And then they must also have at least 2 cognition and mood symptoms. And those are things like trouble remembering key features of the traumatic event, negative thoughts about oneself or the world, loss of interest in enjoyable activities, and even distorted feelings like guilt or blame. Some people with PTSD don't show any symptoms for weeks or months. PTSD is often accompanied by depression, substance abuse, or one or more of the other anxiety disorders. Some antidepressants, such as SSRIs, SNRIs, are commonly used to treat the core symptoms of PTSD. They are used either alone or in combination with psychotherapy or other treatments. Other medications may be used to lower anxiety and physical agitation or treat the nightmares and sleep problems that trouble many people with PTSD. Just a little tip here: sleep aid for patients diagnosed with PTSD. You can also use the off-label. Well, that's one of the off-label uses for Zosyn or Minipress. All right, so non-pharmacologic treatments. Cognitive processing therapy. This therapy focuses on modifying painful negative emotions such as the shame, the guilt, and beliefs such as, I have failed, the world is dangerous. It helps modify those due to the trauma. So therapists help the person confront such distressing memories and emotions. Prolonged exposure therapy. This uses repeated, detailed imaging of the trauma or progressive exposures to symptom triggers in a safe, controlled way to help a person face and gain control of fear and distress and to learn to cope with that. For example, virtual reality programs have been used to help war veterans with PTSD re-experience the battlefield in a controlled therapeutic way. Stress inoculation therapy. That aims to arm the individual with the necessary coping skills to successfully defend against stressful triggers through the exposure of milder levels of stress, much like a vaccine is inoculated to prevent infection after exposure to an illness. Group therapy encourages survivors of similar traumatic events to share their experiences and reactions in a comfortable and non-judgmental way. Group members help one another realize that many people have had these same experiences and felt these same emotions. And then we have acupuncture and then animal-assisted therapy.